them everywhere they go. And the biggest killer of patients in Kenya was not the wrong diagnosis. It wasn't lack of medicine. It was inconsistency of health records that made doctors treat patients who are referred with the same treatment they had in the previous treatments or visits, without realizing that that was not working because there was no record. The birth of DHA from the three laws that were passed, courtesy of Kenya Kwanza, has come to resolve this problem, and our patients are very happy nowadays, walking to hospital, carrying nothing, and they find the records there, even the records of the hospitals they visited before from their previous visits, which are not necessarily the same hospitals. That is a game changer. We are looking forward to a time when a patient in Kajiado will have the need to be seen in Bagathi, and they just walk in, give their ID card, and their records will be there, with their data being correct and also protected, because that is very, very important, not just to us as a country, but also for the patients. So data protection is something that we need a guarantee on, Anthony, because that has been our biggest worry as Council of Governors. I'd also like to, at this particular time, hail you for giving us a promise to give us end-to-end visibility, which includes a dashboard for the CEC in charge of health, also the governor. And I am briefed that that system works on and off, but I'm sure with the effort you put to reach out more counties, this is an issue that will be resolved. Lastly, counties had existing systems or digital health systems. Some of them were inferior to what DHA is offering. Some of them have resistance in accepting DHA because they feel they have had an investment. But if you're giving me a Ferrari and you're telling me to crash my VW, which is very old, I would have to make my calculations so that the VW serves any purpose. We are therefore urging the county government, if you have a system that's inferior to DHA system, it does not matter how much you invested in it. If the DHA system will serve you better, you had better take that one. With those very few remarks, it's now my humble duty to call the CS Health, and even as you comes, and let's give him a clap. Counties have committed to give free treatment in level 2 and 3 and 4, but CS urge patients also to make sure they register for SHA, because you cannot get treatment if we don't know who you are. They must register. Thank you very much.
The Chair of Health Committee of the Council of Governors, Excellency Governors and Deputy Governors, Senators, Honorable Members of Parliament, County Assembly, senior national and government officials, our partners, distinguished guests. Ladies and gentlemen, it is my distinct honor to attend this year's Devolution Conference in the beautiful county of Homa Bay, as we reflect on the theme for people, for posterity, devolution as a catalyst for equity, inclusion and justice, social justice. I am particularly delighted to contribute to this dialogue from the perspective of health care digitization. Universal health care remains one of the most important, powerful tools for advancing equity, justice, and inclusion. Yet many Kenyans, especially in the remote and under-served areas, still face barriers to timely, quality, and affordable health care. Digitization offers a unique opportunity to bridge these gaps. It is more than technology. It's a transformational tool for efficiency, for accuracy, for equitable access, for transparency, and for citizen engagement and empowerment. The Ministry of Health has made digitization a core pillar of the ongoing health sector reforms through very key initiatives, including the Taifa Care digital platform, which integrates healthcare records, telemedicine, insurance management, facility data, and to make sure that we provide care, we prevent fraud, and we improve patient safety and experience. We are also doing community health digitization through the Smart CHAP app. Community health promoters can now register households, report illness, track maternal and child health, and make referrals, hence boosting our surveillance, our responsiveness, and our accountability to the people of Kenya. On supply chain and resource tracking, we now provide real-time monitoring of medicines, vaccines, and medical equipment, reducing stockouts, wastage, and disparity. And finally, on health financing and inclusion, using our digital IDs and mobile money to enroll vulnerable population into the social health insurance, hence enhancing financial protection and reducing unnecessary cost. Ladies and gentlemen, devolution has been a game changer in aligning health priorities with the local realities. Counties are best placed to implement innovations that meet the specific needs of their population. The Ministry of Health continues to work closely with the county governments in the rollout of digital health infrastructure at all levels. We are working with you to build capacity of health workers and ICT officers. We are working with you to strengthen data governance, privacy and cybersecurity, and we want to make sure, colleagues and partners, that equity is not an outcome, it is a deliberate choice. Inclusion and justice in healthcare must be embedded in our system design. We want to ensure that our platforms are accessible to persons with disability. Our platforms are available in local languages. Our platforms are gender responsive. And our platforms are affordable to all. No Kenyan should be left behind in the digital health revolution, regardless of their location, their income, and their identity. Kenya digital health transformation is here and is real. It's reshaping how we deliver care, improve efficiency, and safeguard public resources. Through the Social Health Authority, the ministry is using technology as an engine for equity, accountability, and trust. Since October, SHA has disbursed 57.7 billion to health facilities, and of these, 49.7 billion was channeled to the Social Health Insurance Fund and emergency, chronic, and critical illness, while 6.7 billion supported the primary health care fund. And let me make it very clear here. Our primary health care fund is the one that makes Kenyans to access outpatient in level 2, level 3, and level 4 free of charge, paid by the government of Kenya, appropriated and budgeted by Parliament. When fully integrated, biometric verification will work with real-time claims processing, enabling instant eligibility checks, faster reimbursement, and accurate data, patient data across all our counties. Beyond fraud prevention, this system builds citizen trust and provides actionable insights on service use, on the trend of diseases and spending in order to allow us to make smart investment and fast response. Ladies and gentlemen, Kenya experience demonstrates that digital health innovation, when anchored in sound policy and sustained by strong political will, as shown by the President and the government, and those of us who work with him, and our county governments, we can deliver a patient-centered, fraud-resistant, data-driven health system, serving a model for Africa health resilient agenda. And in this spirit, today is a significant milestone with the launch of the Digital Health Agency Strategic Plan, alongside other guiding documents. This will serve the compass for advancing our nation's health digitization agenda. In conclusion, we reflect on the next frontier of devolution. Let us reaffirm our collective commitment to equity, justice, and inclusion through technology-enabled health system. The Ministry of Health stands ready to walk this journey together with all our partners, all our counties, and our communities. We will close the gap and we will open the future. With those many remarks, it's now my duty and honor to launch the Digital Health Agency Strategic Plan. Yeah. Please, let's clap for DHA. You will not expect hard copies. This is digital. Colleagues are asking me where the copies are. I told them this is digital. So you get your copy digitally, online. Thank you very much.
May we appreciate the CS for Health, Honorable Aden Duale, and his team once more. A better round of applause, ladies and gentlemen. Thank you. Allow me to welcome Tabi and the band for one number as we prepare ourselves to welcome our keynote speaker, His Excellency Engineer Dr. Raila Odinga. Welcome, Tabi and the band.
Unaweza, Yesu, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Twakuinua, tunakupa sifa yoyo, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Tunakuinua wewe, unaweza, hakuna kama wewe. kama wewe. Tunakupa sifa, wewe mwaminifu, unaweza, hakuna kama wewe, unaweza. Yesu wewe, tunakuinua, hakuna kama wewe. Bwana wa mabwana, unaweza. Tunakuinua wewe, unaweza. Hakuna kama wewe. Unaweza, Yesu unaweza, hakuna kama wewe. Wewe kimbilio, nguvu ya wanyonge, unaweza, hakuna kama wewe, unaweza. Yesu wewe, haleluya, tunakupa sifa wewe, unaweza. Yesu yoyo, haleluya. Weka makofi mazuri kwa Yesu. Anaweza yote, haleluya. Inyalo duto, Rabi inyalo duto, onge machalo kodi. Ine matingi malo, ine miromo luongo yoyo, ine minyalo, onge machalo kodi. Inyalo duto, ngamalo ionge, inyalo duto, onge machalo kodi. Inyalo duto, Yesu ine minyalo, inyalo duto, osiepoa, haleluya. Baba unaweza, 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 wewe kimbilio, unaweza. Yesu anaweza, nondo ni wara nono Taya Ine malungi alungi Taya Ini winjori ine madendi kama Taya Onge machielo